Chapter 18, Cardiac Disorders. Now we'll be looking at etiology of cardiac disorders. Genetic causes are increasingly recognized in the etiology of congenital heart disease, now in more than 10%. This may affect whole chromosomes, point mutations, or microdeletions. Polygenic abnormalities probably explain why having a child with congenital heart disease doubles the risk for subsequent children, and the risk is higher still if either parent has congenital heart disease. A small number are related to external teratogens. Table 18.1 shows the causes of congenital heart disease. So the causes of congenital heart disease is divided into maternal disorders, maternal drugs, and chromosomal abnormality. Maternal disorders include rubella infection, which causes peripheral pulmonary stenosis, and PDA, which is patent ductus arteriosus. Other than that, disorder also include systemic lupus erythematosus, which causes complete heart block in those with anti-Ro and anti-La antibodies. Other than that, diabetes mellitus in the mother causes an increase overall incidence of cardiac abnormalities. Next, we'll be looking at maternal drugs. These include warfarin therapy and also alcohol. Warfarin therapy causes pulmonary valve stenosis or patent ductus arteriosus, whereas fetal alcohol syndrome causes ASD, VSD, or tetralogy of Fallot. Lastly, we have chromosomal abnormalities. This includes Down syndrome, which is known as trisomy 21. This causes atrioventricular septal defect and ventricular septal defect. Other than that, there's Edwards syndrome, which is trisomy 18. There's complex cardiac abnormalities. Patau syndrome, trisomy 13, also complex cardiac abnormalities. Turner syndrome, 45XO, causes aortic valve stenosis and coarctation of the aorta. Chromosome 22q11.2 deletion causes aortic arc abnormalities, tetralogy of Fallot, common arterial trunk. Williams syndrome, which is 7q11.23 microdeletion, causes supraventricular aortic stenosis, peripheral pulmonary artery stenosis. Noonan syndrome causes hypertrophic cardiomyopathy or atrial septal defect or pulmonary valve stenosis.